When I was in my final year of medical school, I traveled to Johannesburg, South Africa to do trauma surgery at one of the busiest and highest volume trauma centers in the entire world, Chris Hani Baragwanath Hospital. And this was an eye opening experience for me. There was a bit of culture shock when I arrived. For example, I stayed in a house that had an electrically gated fence around the perimeter to ward off strangers. And my attendings advised me to be very careful when traveling to and from the hospital and pretty much told me to ignore red lights at intersections if I saw any strangers approaching my car. And the divide between white and black South Africans was blatant and explicit. And the hospital experience was unlike anything that I could have imagined. And how I would describe the ER is if you imagine a dimly lit half size basketball court with a long wooden bench table in the center, which is where we would sit down and chart and discuss cases. And then along the perimeter, small little alcoves that were quite dark. And this is where we would often see lower acuity patients and do procedures while wearing headlamps to shine and get enough light to see where we were suturing or doing chest tubes. And then a brightly lit trauma bay, which was attached to it, which was small, but it's where we would often resuscitate critically ill trauma patients. This is the ER that we worked in every day. And every day, I would see so many penetrating trauma cases, like people that were stabbed, and it felt very similar to trying to drink out of a fire hydrant. And the interns and residents would often say to each other, TIA, or this is Africa, to kind of acknowledge how wild every workday was and almost as a point of pride. And this is where I learned how to put in a surgical chest tube for the first time. And on every 26-hour shift that I worked, I averaged about 5 to 7 surgical chest tubes. And one of the local legend surgeons there, Dr. Gigianis, taught me how to secure the chest tube to the skin. And he told me that if I wasn't able to lift the patient off the bed by pulling the chest tube, that I hadn't done a good enough job securing it. And this is something that stayed with me to this day and something that I actually teach my own medical students and residents now as well. And so I have so many crazy stories from my time in South Africa, but what I can say in general is that I miss it. I miss the braai, I miss the culture, the people, I miss the high volume traumas. And I just thought the interns and the registrars were so kind and so incredibly competent with when dealing with high acuity traumas with such little resources and support. And when I compare it to my trauma surgical experiences in Cook County, Chicago, and Vancouver, BC, South Africa was in a league of its own.